Here on CBS in Los Angeles every week, we're taking a deeper look into the toll that this pandemic is taking on our mental health and how we can manage our new normal. Well, our healthcare workers are facing trauma no one could ever prepare for. A doctor in New York, for example, who recovered from COVID-19 and then continued to treat other patients, even ended up taking her own life. And joining me now to talk about this is Dr. Pamela Wible. She runs a suicide prevention hotline for physicians and is also the author of Physician Suicide Letters Answered. Doctor, thank you for the time. Such a serious and an important topic right now.
Thank you for having me, and thank you for broaching this topic, which has been so taboo, quite honestly, for a long time. So really appreciate it.
Well, describe then what these healthcare workers are going through.
So there's really two categories of healthcare workers here. The people on the front lines that are just absolutely overworked and completely taxed by just the level of trauma. Then there's another group of healthcare workers who are almost underemployed and feel helpless to contribute, and they have a sense of guilt. And I think there's stresses on both sides, and there's actually more than one doctor suicide I'm involved with right now related to COVID. So I'm very concerned that this could be a bigger issue over time.
So this is what a lot of these stories are coming in through your hotline. Tell me about that.
Yeah, people that are actually, I've been running this hotline for 8 years, and this is the first time I've ever had calls with people where they're short of breath, they're actually suffering from COVID, they can't speak, and we have to do suicide helpline calls by text. People have been so distraught, crying so much they can't even talk on the phone. And so I'm having to do emails back and forth. So I've just never seen healthcare workers in this state of despair.
Oh my gosh, it's heartbreaking. And yeah, I think for all of us, we feel helpless, and the help you're giving them is just so critical right now. I mean, these calls are so different than what obviously you had before this pandemic.
Right. I mean, there were definitely suicidal physicians before, and actually physicians have the highest suicide rate of any profession. So this was the pandemic before the pandemic. But I think what's happening with COVID, this is a pandemic that is essentially opening a Pandora's box for the world to see really what goes on with the mental health of our healthcare workers.
And shining light and maybe all the extra resources that they need. And even when this pandemic is over, you think the mental toll is going to last obviously much longer?
Yeah, for months, years, we're going to really need to buckle down and actually stop the stigma and discrimination within medicine for seeking mental health care. A lot of physicians don't seek care because they are stigmatized and could lose their license or have license repercussions if they even admit they have depression or suicidal thoughts.
I mentioned feeling helpless. I mean, someone, who, I'm not a therapist, but what can people do then to help our healthcare workers? What can we do?
Well, I think just for the average patient, it would be so great if people could just be appreciative. A thank you card from a patient has actually prevented physician suicides. So, I mean, if you can just be thankful and not write online negative reviews when somebody's running late, they may have just had a death in the next room. So I think compassion from all sides is really needed right now.
Oh, no doubt. And your hotline, how is it different than ones not set up for healthcare workers?
Well, I think healthcare workers feel a little bit, especially physicians, nervous to call like a generic 1-800 suicide helpline. In part, they might be talking to their friend's college-age daughter. They feel that they don't want to be reported to the medical board. And they also know that people who are non-physicians don't really understand the life of a physician. So to try to explain what internship and residency is to somebody who's never been through this, I think we need each other, actually. Physicians need to hear from other physicians who have survived suicidal thinking, like myself, which is why I feel so well equipped to help others.
Wow, absolutely. This is so good to get out there. Dr. Wible, thank you so much for what you're doing and for your time. And we appreciate all the healthcare workers so much.
Thank you so much for covering this. Really appreciate it.
All right, stay safe, stay healthy, please.
Thank you.
And we have some information we want to share because there is help and support available. The state surgeon general says you can go to acesaware.org or you can check out the emotional health resources section on covid19.ca.gov. LA County has a mental health helpline that's open 24/7. That number 800-854-7771. We have all this information on our website, cbsla.com/coronavirus. And if you or a loved one might be thinking about harming yourself, call the National Suicide Prevention Hotline at 1-800-273-TALK. Trained counselors are available, and you just heard from Dr. Wible. So I want to show you this. If you are a healthcare worker and you're having a rough time and you need someone to talk to, you can reach out to her on her website. That's idealmedicalcare.org. Again, idealmedicalcare.org. It is 100% confidential. Get the help if you need it, please.